Hi, my name is Dr. Barry Triestman, and today we're going to talk about ice and inflammation and how it is going to help you get better faster. So in general, whenever there is going to be an injury, and an injury can be a re-injury, which could just be I just hurt that a little bit more than it already has been hurt, or it could be something much bigger when you didn't have any hurt. Either one of those, ice is going to be appropriate for at least the first 48 hours. And the reason that ice is going to be appropriate is that we are trying to close down the blood vessels and shrink the amount of swelling in the area. And whenever there's an acute injury, we produce more inflammation. We really want to decrease that inflammation because it is going to affect how the muscles fire and also how much pain we feel. The firing of muscles is altered anytime there is an injury. Generally, if we move and we're not injured, the muscles will contract before we move. So they contract, we move. After there is an injury, what happens is that contraction is delayed. Meaning that when we move, the contraction happens afterwards and it is not able to properly stabilize the body. I move and the muscles contract, and that they can't stabilize after motion has been initiated. So by decreasing the inflammation, we get that normal motor contraction or normal muscle contraction back or closer to normal, and that's going to help stabilize the body. If the ice alone isn't doing it, we want to think about using some additional anti-inflammatories. And those could be over-the-counter anti-inflammatories of two different categories. Generally, they could be something of an enzyme, which we take between meals, or they could be something stronger, more powerful that could possibly have side effects like an ibuprofen or one of those non-steroidal anti-inflammatories. We do need to be careful with the drugs because they do have side effects, but they're still great tools to be used on an unoccasional basis, meaning that for a few days, that's great. If we're using them for more than a few days, we need to find out how else we can stop that inflammation, because they do slow healing. Inflammation is part of the healing process. So when it comes to icing, or doing any anti-inflammatory, we want to do it right before an activity because of that muscle pattern correction. We want to do it after an activity because we might actually be increasing the inflammation by doing an activity. And anytime we're going to be still for a long time. So being still for a long time could be going for a car ride, or it could be going to sleep. And I often see patients who come in and they complain about being very, very stiff in the morning, and that's because of the injuries they did the previous day and them not doing enough anti-inflammatory things to stop or decrease the amount of inflammation. We don't just blindly do an anti-inflammatory procedure, whether it be ice or taking something. We also want to think about, hey, what did I do before provoke this increased inflammation? Because that's all part of the things that we need to figure out to repattern the body so that we don't injure ourselves. When we ice, generally a large, thick part of the body, like the lumbar spine, the low back, the disc, the buttocks, the hamstrings, because they're so thick, we want to ice them for at least 20 minutes, but not really more than 25. If it's a smaller part of the body, like an elbow, for example, a tendinosis in the elbow, we would want to ice for about 15 minutes. And we want to give ourselves an hour off. The amount of time that we do the icing is important. If we do it too long, the body has something called the hunter reflex, where it is going to do the opposite. It's going to open up the blood vessels and promote more inflammation because the body thinks that it's freezing and it's trying to protect that part of the body. So timing wise, and then we also need to find a comfortable way to do it. We're going to show you some ice packs that we think are the best ways to do it, and also some particular body positions that will help heal. The other part of icing is that you're taking this 20-minute period and you're actually resting. And that's an important thing. We often don't take time to rest after we've done something. And when there's an injury, there's an increase in fatigue in the area. So rest is super, super important. Don't forget the rest. And we get both when we ice and we stay still for a while. Thanks. Hope you get a lot out of this information and get better. Any questions? Give me a call, email me. Thanks. Okay, so this is kind of my preferred pack when it comes to icing the back. It's the Copac 14x17 pack, and it feels really good when it's under the body. It gives you nice even support as opposed to using a Ziploc bag with some ice, which doesn't give you quite as even support, but you can get it there. But I just think this is just far more comfortable. And when we're irritated, we want comfort as much as possible. They also do have a blue one that's not quite as industrial strength, doesn't last as long. When it comes to the care of these guys, when you put it in the freezer, you do want to put it in a bag so it doesn't dry out. We can also use this for other injuries other than the low back. We can use it for a thigh, a neck, a knee. You could even put it on your elbow. It really is that versatile. You can buy smaller ones also, but I just like this one because of its versatility. And so what we want to end up doing is we want to put it on a flat surface, and usually a nice carpeted living room is a great thing to do it on, and then we're going to lay on top of it. And when we lay on top of it, we want the lowest part of the lumbar spine about 5 or 6 inches from the bottom, and that's really where we're going to get the most use, because it's going to work on the sciatic nerve a little bit and get it nice and cold, or bring down the inflammation in that area also. So if I use my friend the skeleton here, kind of the top of his crest or hip bone is about 5 or 6 inches from the bottom, and that's usually a good place to put it. So I can find the top of my hip bone by just kind of poking in and going down and feeling where the top of the bone is, and then you can feel it gets much harder there. And that's kind of where you want to be, about 5 or 6 inches from the bottom with that. And also when you lay on your back, when you do this, and this really is the best position to ice in, you want to put something in back of your knee so it's bent a little bit, and you can vary the height of this. Your guide is that you want everything to feel really super nice and super comfortable, and this is how you get some great icing and great anti-inflammatory results. Let me show you with me on it. So when I get down, I always want to make sure that my core is nice and straight and engaged, and see the Powerhouse and Ideal Alignment video to get and understand that. And that's also a big part of your healing. So do work on that, because that's the long-term health thing that you need to do. Okay, so I'm just going to kind of roll onto my side, trying to keep my spine nice and straight. And then once I'm totally on my back, or totally on my side, then I'm going to roll onto my back. And like I said, you want to kind of get this guy so it's just kind of, from here 6 inches above and then all the way down, and it should feel awesome. And this does, it supports, it's nice and cool, and this is how you ice your back. Thanks. Have a great day. I hope you enjoy it. I hope you get a lot out of it.